Hi everyone, this is Crystal Beauty 101 and I wanted to do a video for my subscribers that subscribe to me based off of my nursing videos. So if you are interested in nursing or just want to watch this video anyway, keep watching. So I wanted to do an update on how it is to be a new grad working in the hospital. I'm currently living in South Carolina, and I moved here from Pennsylvania. And in Pennsylvania, I was working in a nursing home, and that wasn't something that I wanted to do. I just did it because it was the only job that I could get, basically. Everywhere I applied to in Pennsylvania told me to get experience and then come back. But how am I supposed to get experience if nobody wants to hire me? Well, the nursing home did that. And the nursing home, it was very relaxed, nothing exciting, because I have a BSN degree and I went to a nursing school that is a 4-year program, and it teaches you critical thinking skills, and it teaches you a lot of nursing skills that you wouldn't get in a community college. So my degree has more education to it and more money to it. So I felt like working in a nursing home, I wasn't being allowed to practice my skills that I did in school. You don't put in any IVs, you don't put in any type of NG tubes, or you don't do any of that stuff. All you do basically is give medicine. But since I had a BSN degree, they wanted me to start working in the office. And I felt like at the time, I'm 24 years old and I haven't even worked on my nursing skills yet in a hospital setting, and already they want me to work in an office position for nursing, and I felt like the nursing home was something that I would do if I'm about to retire. But as a new grad, unless you like that type of controlled environment, I don't like that type of environment for a new nurse, because you're losing all your skills you've worked hard for, and it's just like it goes down the drain. It's like if you don't use it, you lose it. So I kept applying to hospitals. No one's want to hire me. So my fiance, he lives in South Carolina, and he told me to apply to a hospital here. I applied to 3 different ones in this area. Well, the first 2 I applied to, they kept writing back saying that they went with other people. So then he was like, well, try this one. So I tried another one, and within 2 weeks they call me and they say, first the lady, she said, what, are you in the area or are you still in Pennsylvania? And I told her I'm in the area, but I'm willing to move at any time. So then she said, okay, well, what type of nursing floor do you want to work on? And at this moment in my life, I'm desperate. So I say, it doesn't really matter. I just want to work in the hospital. So she says, okay, but what's a nursing position that you really want? So I said, I always wanted to work on the med-surg floor. And she said, well, that's perfect, because that's the position that we want filled. And I was like, oh my gosh, this is like a dream come true. So she went on to explain that it's a med-surg, acute care, step-down, ICU type floor with like heart failure patients, cardiovascular, and basically acute care. So I was like, oh my gosh, that's perfect. So then she says, she knows I'm a new grad, she says, but how fast can you learn, because this is a fast-paced floor? And I'm like, that's exactly what I'm looking for, because that's what I did in school, and I feel like I'm not using what I did in school. So she said, well, I can come down for an interview. When can I come? I said, in 2 weeks. She said, that's too far. How about next week? I said, sure. So I basically had to take off from my job at the nursing home just to come down to South Carolina, a 10-hour drive by myself, to interview for this RN position on the med-surg unit. So I got there, and the interview, it was two ladies, two directors. They're both nurses, but they're the directors. They have their masters. And the interview wasn't anything like interviews I had in Pennsylvania. In Pennsylvania, the interviews were so strict, and they're asking you all these intense questions like, what would you do? Which one would you do first? And they're giving you all these scenarios. And it's like, why are you trying to make this interview so hard? Obviously, I graduated from nursing program. Obviously, I passed my state boards to get to this interview. So why are you making the interview a whole nother obstacle? I just didn't like that. So then, this interview in South Carolina, the only question the lady asked me was, what am I afraid of? Or what would worry me? And I said the only thing that I can think of is that I'm 25. I then turned 25. That I'm 25 and that no one would take me seriously. But I honestly didn't have a worry for that. I just couldn't think of anything else, so I just said that. And I forgot what she said. I don't even think she even cared about the response, because a lot of the girls there are new grads, and they are 24, 23, 25, so whatever. But she said that basically we are like a family. We help each other. We work with each other. We don't treat anybody any different based on degrees and stuff. And I was like, wow, this is perfect. So the interview was so nice. We were just laughing, talking, looking at pictures. My fiance came up. Well, the talk of my fiance came up. Then they asked to see pictures of him. And it was just a nice interview. It wasn't even like an interview. It was just like a get to know you, basically. Because I don't think they would have let me drive 10 hours just to tell me no. But basically everything they said was what I wanted. And they kept reminding me that it's fast-paced and it's a hard floor. And in my head I'm like, do you even know what I went through in nursing school? Like, if I can go through that, I can go through anything. The only part about nursing school that was hard was the test. We had to test every week. That makes it hard. But the actual nursing was fine. So yes, life of a graduate nurse, a new grad nurse, is amazing. I've been working at that hospital for 2 months now, and I love it. Some days it's very, very, very fast-paced, and other days it's very relaxed. It's still hard, but it's relaxed compared to the other days. The most patients that you would get is 6 per nurse. And I love it that way because I have a friend who lives in New York, and she gets 8 to 9 patients, and she hates it. She wants to scream. And I told my director that, and she almost like cried. That's crazy. How are you going to have 8 to 9 patients? And my type of floor, when you have 6 beds filled up for that one nurse, it's like you don't really get a break. But I love it. Let's see, how can I describe it? The patients that come in, they have heart problems, heart failure, telemetry, which is the EKG monitor on. They have basically acute care. They come from the ICU. A lot of them come from the ER. A lot of them come from the doctor's office. A lot of our patients, they go to the ICU. You have cellulitis patients, diabetic patients. I had one patient, their blood sugar was 1,020, and I had to call lab to draw blood to make sure that was correct, and it was. So then I had to call the doctor and order boluses of fluids, and I had to give 16 units of insulin. And we just have, we get lots of drug users. get lots of surgery. I get lots of surgical patients. Lots of them going down for surgery. Lots of them coming back from surgery. They basically, a lot of them have abdominal surgeries, and I think that's all the surgeries. Oh, ORIF, which is hip replacement surgeries, and different things like that. It's a med-surg floor. Med-surg is the heart of nursing, so you get everything. I've put in so many IVs, I lost count at this point. In the beginning I was counting, but I lost count now. It's so much fun. I get to practice all my skills from school. I talk to the doctors all the time, what's going on with the patients. I have to call them if something critical is going on. I work a 7 p.m. to 7 a.m. and it's a 12-hour shift, and it's 84 hours a pay period, and it's lots of overtime. Every paycheck I get overtime because you don't leave exactly at 7 because you have to wait and give report to the next nurse. We don't report like some hospitals. You just wait till the nurse comes and you tell her what's going on. Let's see. Anyways, I love it. I love working in the hospital. I want to work there for like 5 years at least, minimum. And I love nursing. I see myself, I guess when I'm about to retire, doing an office position, like supervisor or something. But I love bedside nursing. I have no complaints. I don't know what else to say. You're on your toes a lot. In the summer, it's more relaxed. We have something called on-call, and they put me on-call last Friday. And basically, one of the directors called me and said, would you like to be on call? And I was like, yes. You stay at home and you wait for your phone to ring if they need you that day. And the reason why they would put a nurse on call for that day is if the census is low and they don't need an extra nurse. So you still get paid, but you're at home, and you just have to be ready and available to come in within that 12 hours that you were supposed to work. And they didn't call me at all last Friday when I was on call, so I basically got a free day, and you still get paid for it. But that's how it is in the summer. That's why they hired me around this time, because they can train me. I'm already done training. I forgot to tell you guys that part. I had 6 weeks of orientation with a new grad nurse. I was happy they put me with a new grad nurse. She's been there for 8 months, because a lot of the nurses that's been there for 10 years, they're not going to slow down and show you and explain everything because they're so used to doing it for 10 years. They're going to think like, oh, well, hurry up and know it. But it was a great orientation. I was supposed to have an 8-week orientation, but they said that I was doing so well that they cut it to 6 weeks, and that next week they put me on my own. So I'm so happy. I love it. This is exactly what I wanted to do. I don't know what else to say. Basically, if you have any nursing questions that you want me to answer, just put them in the comments below. This is the life of a new grad nurse. Oh yeah, you learn in school that in the first year it's going to be hard, and then the 3rd year it's getting easy, and then by the 5th year you're an expert. I mean, it doesn't have to be that way if you have a good team around you. And if I ever need help with anything, I have people around me that are checking up on me. Are you okay? Do you need help? Sometimes I don't even ask for help, and they can just see that it's busy right now, and they'll just jump in and help me. But I love it. It's awesome. I'm learning so much, and I'm just so proud of myself. Like, you think you don't know anything, but then when you're in that moment and then in that situation, that's when you just start doing things, and you're like, oh my gosh, how am I doing this? But anyway, please put questions below if you want me to answer anything about being a new grad, nursing school, anything about nursing, because I'm done nursing school, obviously, and I already got a hospital job. So the only thing that is left is time, basically, for me to call myself an expert. But right now, I'm just fulfilling the new grad mindset of being a new graduate nurse, and I love it. I'm on my own, have my own patients, have my own everything, and it's awesome. And the people I work with, the people you work with makes a big difference too. I love the people I work with. It's like we all get along, it's all like a family, and I don't know. But yeah, let me know if you need to know anything else. Thanks for watching. Bye.